So good afternoon. We're here today to outline our updated budget proposal for fiscal year 2021. This updated budget plan reflects the new realities associated with COVID-19, but continues to make significant investments in education and economic development, and it does not raise taxes. As you all know, we filed an FY21 budget proposal what seems like a very long time ago, back in January. But since then, obviously, as everybody knows, the world has changed in a big way. As is the case for all other states, COVID-19 has created significant budget uncertainties here. The Commonwealth's projected revenue for fiscal year 21 dropped by about $3.6 billion, according to new projections that we were required under state law to release today. We also extended several tax filing and payment deadlines to reduce the burden on residents and businesses, which further scrambled the revenue picture this spring and this summer. Fiscal 20, as we've talked about before, is basically fine and will be put to bed hopefully at some point when we wrap things up with the legislature there. Along the way, we faced unexpected budget costs as we responded to this pandemic, which included a number of programs that are funded with both state and federal funds. There's about $1 billion through Mass Health to help stabilize healthcare providers, nearly $50 million for field hospitals, a total of $90 million that we were committed to deliver to our contact tracing program, $56 million to address food insecurity, and $350 million to support PPE acquisition and distribution. It's pretty obvious early on that the drop in revenues and other factors would significantly impact the budget picture, which is one of the reasons why we in the legislature decided to issue a series of one-month budgets until some of the smoke cleared with respect to what fiscal 21 would actually look like. Although I would remind people that in the midst of that, we did file and the legislature did enact a year's worth of unrestricted general government aid for cities and towns and Chapter 70 funding for education. But fortunately, in many ways, thanks to our fiscally disciplined approach to budgeting over the past few years, we had a number of tools in the toolbox to help us respond to this challenge. The biggest and most significant benefit of that fiscal discipline is the fact that we've managed to triple the size of the state's rainy day fund, which today stands at an all-time high of $3.5 billion. In fact, when we signed last year's budget, we added another $500 million to that rainy day fund. We've also worked to find budget savings over the past few years, and we've worked particularly hard to rein in the growth of the big cost drivers associated with the Mass Health program. That careful approach to budgeting has allowed us to build up reserves and to deal directly with the difficult times we're now facing without going back to the taxpayers. The hard work of reining in the budget over the past few years allows us also to invest in priorities that matter now more than ever in economic development, public health, and education. The budget we're submitting today is a $45.5 billion budget recommendation to the legislature. That updated budget makes significant new investments in Main Street economies and our pandemic response and in our schools. The budget also sustains support for important services like healthcare, local aid, and transportation. And the funding is available to support these programs and especially will be applied disproportionately to communities that have been affected particularly hard by the virus, including many of our communities of color. And we're doing this again without raising taxes, especially because of the current state of the economy, and the idea of going back to the taxpayers given their own situation just didn't seem like the right thing to do. Some highlights from the budget plan. First, let's talk about education. Since the beginning of the pandemic, we've made about $1 billion in state and federal resources available to local cities and towns, much of it so that they can safely get kids back to school. Today, we're also proposing $5.3 billion for K-12 public schools to local municipalities. After recognizing the significant level of federal funding that was made available to districts, year over year, K-12 education spending is more than what was originally proposed in our budget from January, which fully funded the first year of the Student Opportunity Act. We're particularly proud of this achievement. A lot of people rightfully worried that with the passage of the landmark education funding bill, we wouldn't be able to meet those obligations. On economic development, we worked pretty hard to develop a program to support main streets and small businesses. Back in June, we announced a revised economic development package called Partnerships for Growth. That $275 million package aims to promote future job growth and empower local cities and towns to recover from the economic challenges caused by this pandemic. That is currently in a conference committee. We anxiously look forward to having a chance to signing that bill and putting it to work. The budget we're submitting today supports that plan with an additional $100 million in economic development initiatives that aim to provide workforce development improvements, better connect workers and businesses, and support small businesses. Some key aspects of this economic development initiative include $35 million for grants for small businesses and an additional $3 million for technical assistance for small businesses. And these will be particularly focused on supporting minority-owned and women-owned and veteran-owned businesses. There's another $35 million for community development, financial institutions, grants and loans, another $15 million in matching grants for capital investments by small business, $7.5 million for technical assistance and grants, including for small businesses, online and digital tools, and $6 million for regional recovery planning grants, which is an increase of $5 million over fiscal year 20. The Economic Development Initiative will be funded by changes that modernize the sales tax collection system for the first time in decades. These changes do not increase the amount of sales tax to be paid, and they only apply to a handful of the largest corporations that do business in Massachusetts, but the revised payment schedule will create a one-time increase in tax revenues. Our budget calls for putting these funds to work for small businesses and Main Street economies. Our budget also focuses $8.4 million in new funding that will help support our efforts to transform vocational high schools into career technical institutes. This was a major initiative in our original FY21 budget. This initiative will train 20,000 new workers in skilled trades over the next 4 years, and we believe this program is more important now than ever as workers are looking for secure, better-paying jobs. The budget also advances the recommendations of our Black and Latino advisory commissions, and especially investing in these programs at this point in time is more critical than ever. And despite the turbulent fiscal environment for state government, we must continue to promote economic empowerment, especially for people of color across the Commonwealth. The budget continues to make significant investments in workforce development, education, and small business support, which were all recommended by the Black and Latino Advisory Commissions. On housing, earlier this week we announced a comprehensive plan to provide support for residents and families to help them avoid evictions and foreclosures during these unprecedented times. The budget proposal we're announcing today builds on that and includes $123 million for the Mass Rental Voucher Program, $72 million in funding for local housing authorities, and $182 million for emergency assistance associated with our family shelter system. On healthcare, in addition to sustaining the public health investments we've made to battle COVID-19 that I mentioned earlier, this budget also includes $160 million to support Chapter 257 human service provider rate increases, which is a significant investment that reflects the important work done by these providers, especially during this pandemic. It also includes a 10% increase in funding at Mass Health, which will support the increased caseloads due to COVID-19, as well as costs associated with our public health response. A total of $316 million to combat substance misuse is also going to be filed as part of this budget, which continues our work to battle the opioid crisis and other addiction issues as we confront this pandemic. There are several other important areas of investment as well. $1.2 billion in operating funds for the MBTA, which is in addition to the T's 5-year, $8 billion capital plan to upgrade, modernize, and improve their system. a total of $386 million for the Massachusetts Department of Transportation, including full funding of its snow and ice budget, and $20 million for the Massachusetts Emergency Food Assistance Program to further our efforts to fight food insecurity. Thanks in part to the work we did to build up our reserves and our responsible approach to budgeting generally, this revised proposal enables the Commonwealth to make significant investments in our recovery while continuing to fund key services that support our continued fight against the virus. We look forward to continuing to work with our legislative colleagues as the budget process moves forward, and we remain committed to supporting all of our residents throughout this public health emergency and the ongoing recovery. Before I close, I want to thank Secretary Mike Heffernan and his entire budget team at the Executive Office Administration and Finance. Special tip of the hat to Catherine Hornby and her team for all of their works. And I also want to point out how incredibly hard they've worked, not just on this budget, but on so many different elements associated with the Commonwealth's and our municipal partners' financials over the course of the past 9 months. Now I want to turn it over to Lieutenant Governor, who will talk a little more about how this plan supports cities and towns. Thank you.
Thank you, Governor, and good afternoon. I'd also like to thank Secretary Heffernan and Catherine Hornby and your incredible team for your hard work to revise this budget and for your ongoing work to help our communities of our Commonwealth and to obviously provide the resources for us to fight the COVID-19 in our Commonwealth. The funding allocated in this budget proposal will continue to support communities and families throughout our Commonwealth as we work toward COVID-19 recovery, and will build on our ongoing partnership to fund critical programs and municipal services. We also recognize the incredible importance of our local governments and vital roles that effective municipal services and supports play. This budget proposal will maintain local aid to cities and towns, and it will do so without raising taxes. We recognize how absolutely critical local funding and aid is to our communities. And for that reason, this budget will ensure that cities and towns receive no less than their fiscal year 20 level funding for unrestricted general government aid, also known as UGA, and Chapter 70 education funding. All in all, this calculates to a Chapter 70 education investment of $5.284 billion, an increase of nearly $108 million over the fiscal year 20 spending, and an UGA total investment amounting to $1.129 billion. Upon taking office in 2015, our administration also launched the Community Compact Program, which champions municipal interests across all of our executive secretaries and agencies and develops best practices across our state for and with municipalities. This proposal recommends an additional $4 million to support the Community Compact related programming and initiatives, and obviously provides an important tool as cities and towns look for creative ways and innovative approaches to providing services in a COVID environment. Also included in our proposal is an additional $3 million for district local technical assistance and $4.75 million for the Public Safety Staffing Grant Program, which will provide Massachusetts communities with access to funding and resources necessary to support the health and well-being and safety of their residents. COVID-19 has revealed limitations in cities and towns' technology and IT services, and has highlighted the critical need to bolster resilient and reliable technology systems for municipalities. Furthermore, many workplaces have continued to pivot to remote operations to ensure the health and safety of their employees, and with that adjustment comes an increased need for advanced technology, security, and digital services. This budget proposal recommends $135.6 million in fiscal year 21 spending by the Executive Office of Technology Services and Security to support the Commonwealth's technology needs and initiatives, including managing a new cybersecurity operations center which provides 24/7 capabilities, monitoring capabilities of systems, implementing a security incident event management software platform, and continuation of EOT's information governance program. And as we continue to move forward in this new normal, reliable, consistent, and safe technology systems are integral to the Commonwealth's recovery and continued development. While COVID-19 has brought forth unparalleled difficulty for families, individuals, and businesses nationwide, as the need for self-isolation and social distancing has increased, one of our most vulnerable populations has been left particularly isolated, and that is our survivors of sexual assault and domestic violence. Our administration and the Governor's Council to address sexual assault and domestic violence has worked collaboratively with our community partners and stakeholders to ensure that survivors and their families had access to services and supports necessary in this time of crisis. Our budget proposal recognizes this critical need, and the proposed investment of $82.8 million will support and strengthen our administration's ongoing efforts to strengthen and improve sexual assault and domestic violence prevention services, as we see our safety net for this community across our Commonwealth. This is a $2.4 million or 3% increase over fiscal year 20 and nearly a 30% increase from fiscal year 15. This critical SADV investment will support $46.8 million in funding for DPH to carry out domestic violence and sexual assault prevention and survivor services, and emergency and transitional residential services for victims and their children. This includes $6 million to support the statewide sexual assault nurse examiner program, as well as $1 million for a grant program that focuses on promoting healthy relationships for teens across our Commonwealth, amplifying the Respectfully campaign. $1.6 million for DCF to meet the needs of families involved in domestic violence situation and the Sexual Abuse Intervention Network, and $31.2 million for DHCD to provide shelter, services, and housing assistance for individuals and families who are victims of or at risk of domestic abuse at home. On behalf of our entire administration, I'd like to thank the advocates and community leaders who have committed themselves to ensuring safety and security of survivors over these past months and your ongoing partnership and ongoing work in the months ahead. I'd now like to turn it over to Secretary Heffernan and once again thank him and his team for their hard work on this budget.
Thank you, Lieutenant Governor. I'd first like to acknowledge and thank the Governor and the Lieutenant Governor for their leadership and guidance throughout the difficulties of the past number of months and throughout this budget process. Thank you. I'd also like to recognize the exceptional work and long hours of our Budget Director, Bran Shim, his deputies, Sophia Capone, Olivia Graham, Olivia McCaffrey, and Paul Chong, along with our very hard-working and long-suffering fiscal policy analysts and our general counsel team. And a special thanks to our Undersecretary, Catherine Hornby, and also a shout-out to our my fellow cabinet secretaries who have made many contributions to this budget exercise. This budget cycle, not surprisingly, has been very different from past years due to COVID-19 pandemic. Our team has worked through numerous unexpected challenges created by the rapidly changing economic and fiscal landscape. Throughout this time, we have routinely met with our counterparts in the legislature, and we continue to benefit from an ongoing and productive dialogue with Ways and Means chairs, Aaron Michaelwitz and Mike Rodricks and their teams, and we have met throughout the pandemic. I must again thank them for their ongoing collaboration. Let me just briefly outline some of the notable fiscal aspects of this new proposal. Revised House 2 includes $45.5 billion in gross spending, which represents an increase over our original House 2 proposal. This is primarily driven by increased caseload costs at Mass Health related to the COVID-19 pandemic. This budget is based on our newly revised fiscal 21 tax revenue forecast of $27.592 billion, which was adjusted down $3.559 billion from the consensus revenue agreement that we agreed with the legislature and announced back in January. Our proposal protects essential government services, including local aid to cities and towns, and maintains eligibility and benefit levels for both social and health safety net programs. And it continues to fund critical priorities, including health and human services, housing, transportation, education, workforce development, and the environment. Revised House 2 does all this while also maintaining ongoing commitment to fiscal discipline and responsible governance by not relying on new taxes and limiting future exposure to ongoing economic challenges. Our revised budget optimizes the use of federal and state revenue to minimize the risk to core government services during the COVID-19 pandemic. Our revised House 2 proposes a maximum withdrawal of $1.35 billion from the stabilization fund and would subsequently be reduced if tax collections improve or there are new sources of federal revenues. This withdrawal is about 3% of our total budget, and that would leave a projected stabilization budget of more than $2.1 billion for fiscal year 22 and the future years as we ease away from the use of one-time revenue sources. As the governor mentioned, we are recommending a more than $100 million economic development effort to assist small and diverse businesses across the Commonwealth. This initiative is supported by our proposal to update and improve the collection and remittance procedure for the state sales tax. The current procedure is quite antiquated and was designed for the days of paper checks and manual cash registers. Today, retail vendors can hold sales tax that is paid by a consumer for as many as 50 days after a purchase. The initial phase of sales tax acceleration will consist of the Commonwealth's largest businesses remitting sales tax collections from the first 3 weeks of each month in the final week of that same month. This phase will have absolutely no impact on consumers, nor nearly 95% of Massachusetts businesses that collect sales taxes. The revised budget incorporates a higher threshold to protect more small and mid-sized businesses and would be squarely focused on the largest companies, many of which have benefited from changing consumer buying patterns during this crisis. Our budget also continues building on the progress we have made over the last 5 years. This budget incorporates the first full year of the reduction of the Part B individual income tax down to 5%, and it keeps to the pension schedule that we announced back in January. Again, we acknowledge the partnership perspective and the great work done by the leadership and the staff at both House and Senate Ways and Means, and we look forward to working with our colleagues in the legislature to deliver a responsible budget for fiscal 2021. Thank you.
Questions? Bruce?
Governor, a little hard, put it in simplistic terms if you could. It sounds like we're in a terrible economic period, and you're raising spending over what you were predicting pre-pandemic.
Pretty neat trick, huh?
It is. How does that work?
So there's a couple things going on here. One is we saw, on the healthcare side in particular, a real change in just the run rate in healthcare spending generally after COVID. I mean, the irony here is we were spending a ton of money on COVID, as were many other people, but at the same time, all kinds of other healthcare services just moved away from the healthcare system generally, and telehealth actually played a big role in giving people an ability to access clinicians and engage with, and for clinicians to engage with patients. But there's definitely been a drop in the historical run rate in healthcare spending. And we expect that that will continue through part of 2021 fiscal. The second thing is the federal government continues to operate under an emergency procedure, primarily because of COVID and the impact it has on healthcare. And as long as states commit to not doing eligibility redeterminations, which we've committed to because we don't want people to end up without health care in the midst of all this, they accelerate or enhance the reimbursement that you get from them. And for us, that's a 6-point increase in federal revenue for Mass Health Services, which makes a big difference. The second thing is we have a $3.5 billion rainy day fund. This budget does give us the authority to draw up to $1.35 billion out of the rainy day fund to support 2021. It still leaves over $2.5 billion, $2.2 billion, 2.1 for fiscal 22 if that should be required and necessary. And the other thing is there was a significant amount of federal resource, either through FEMA or through the COVID relief acts, that were made available to states to fund expenses in public health and public safety and healthcare that were directly related to COVID. And we are deploying those resources in ways that are consistent with the federal guidance as part of this budget. So those are kind of the big three.
So that sounds, but are you spending more? You're spending more.
We will spend more in fiscal '21, House 2, as we proposed it, state and federal resources, than we were planning to spend in House 2, not House 1, House 2, fiscal '21 that we filed back in January.
What's the difference?
Pardon me?
How much more?
I think it's about is it about $1 billion? 900 million? Yeah.
900 million? 900 million. It's hard to hear the B's and the M's.
Yeah.
Billion and a million. It's the rainy day fund is 3.5 billion.
Right. Rainy day fund is $3.5 billion. This thing gives us the authority. If tax revenue comes in higher than is currently anticipated, obviously we would take less out of the rainy day fund. But the rainy day fund is there to support services when it's raining, and I think most people would agree it's raining.
But weren't you assuming that next year is the really, when you're up against the wall, wouldn't you want to start cutting spending earlier rather than wait until next year? Or
Well,
you-
we still got, keep in mind, we still got over $2 billion in rainy day fund resources available next year, and you have to remember that the hit we took in fiscal '21, at the beginning of fiscal '21, is not what most people are projecting the rest of fiscal '21 or fiscal '22 is going to look like economically. I mean, most people do believe that this thing is going to be one of these. Now, it depends a little bit on how fast it comes out of that, but no one's expecting there to be anything like the downturn we dealt with in the last half of '20 and the first half of '21
Governor,
on the employment and revenue side.
following up that, you've repeatedly talked during 5 years of avoiding one-time resources in the budget, saying, obviously, they're unreliable, because you can't count on them next year. But to essentially fill this entire gap with one-time resources, is that, building on sort of that same question, where does that leave you going forward? Because this is $3 billion, technically we wouldn't have, but when you have to release a proposal in January.
I think it's the work that we did not spending one-time money over the course of the past 5 years that put us in a position to be able to work our way through 2020 and 21 and still have over $2 billion in our rainy day fund available for 22.
So in your talks with the legislature, there was a lot of talk that you guys would do a joint budget, but it sounds like you decided not to do that. You're doing your own thing. What's your timetable for this? Is this November, January? When do you want to have it done?
So there have been ongoing conversations all the way through this process with the legislature, and the fact that we're filing this once we all have an understanding about what fiscal '21 revenue looks like is not going to be a surprise to them. I actually don't even think a lot of the parameters of this will be a surprise to them. But keep in mind that it's our hope that we'll get this back before Thanksgiving. And the reason I say that is Thanksgiving is around the time when the executive branch starts doing the work to prepare for the next fiscal year, right? We file our budget. The fiscal '22 doesn't start until July of '21, right? But we file our fiscal '22 budget the third week in January, and typically Thanksgiving is around the time when we start preparing it. And one of the major elements that is fundamental to preparing the fiscal '22 budget is going to be the baseline of fiscal '21. So it's our hope that we got our tax revenue number in. We were statutorily required to report on that. We took the number that's, I would call, the most conservative of the ones that these folks got along with the legislature at that hearing they had last week. We put this out there. We assume that we'll probably have a one-month budget for November, which will probably get filed shortly and enacted shortly after that. And the theory here is that the legislature would then work their way through our budget and produce their budget by around Thanksgiving, and then we take that budget and it would become the baseline for the work that we would need to do to file a '22 budget in January. Well, we've been talking to them. First of all, we're 4 months into the fiscal year to begin with. Secondly, a lot of the issues associated with the puts and takes associated with federal revenue. Remember, we were standing in front of you guys maybe in June, and talking about the importance of getting legislation passed that would appropriate for the FEMA reimbursements. That part's been pretty much sort of resolved at this point. We've gotten a ton of clarity from the feds about how other federal resources can be used by state and municipal governments to support various programs. And I think at this point, a lot of, and fiscal 20, the tax revenue came in July, tax payments in July that should have been made in April so that we could clear up the end of fiscal 20. I mean, there's a lot of sort of unknowns and fog that at this point, on both the revenue and spending side, has sort of cleared out. And I don't really, I mean, I don't think a lot of what we're filing today is going to be hugely surprising to the legislature. I mean, I think it's going to be reasonably consistent with the conversations we've been having with them. It obviously won't look exactly the same when it comes back, because it never does. But I would think that they could make this happen sometime between now and Thanksgiving.
Governor, would you veto any tax increases should the legislature pass any part of their budget?
I don't think we believe we need a tax increase at this point, no. So I would, yeah.
Governor, can you speak about the troubling break-in at your home? Obviously, your family members were home. I think most people just want to know, is everybody okay? It's got to be troubling, at least, especially in this climate.
Everybody's safe. That's the only thing that really matters, and that's all I'm going to say about it.
Do you think that Massachusetts should have a governor's residence?
Everybody's safe. That's all I care about, and I'm not going to talk about it.
Governor, I wanted to ask you about the number of deaths from COVID in Massachusetts in
Yeah.
September. According to the Globe, Massachusetts had more deaths in September from COVID than New York and New Jersey combined, and more than any other state surrounding us, certainly way more than Connecticut. What's going on? Why is that?
So, first of all, two of the academicians that were quoted in that story said comparing state-to-state data when it comes to death data, especially this kind of death data, is a challenge. I've talked to several academics over the course of the past few days who've all said exactly the same thing. In fact, one of them said it would be terrific if somebody would do a study of how states actually collect and report death data, not so much to resolve issues associated with today, but so that there would be a uniform reporting process for dealing with, God forbid, reporting in another pandemic. I mean, I know that some states report, and the story pointed to this, that in some states, where you die is where you are with respect to how they report where the death occurred. In Massachusetts, if you die in a hospital but you came from a long-term care facility, you get reported as having come from the long-term care facility. Different states do different things with respect to how they test for COVID and comorbidities with respect to how they write those death certificates. There's a lot of variability here, and I think as an academic exercise, we are going to take seriously the idea of maybe trying to find somebody to do a study on this, not just for today, but for reporting on issues like this going forward.
Governor, could you speak to, despite having education increases, there's still that delay in implementation for the Student Opportunity Act, right? So can you sort of speak to how the Commonwealth might prepare to sort of deal with that or compensate with the changes in that long-term ramp-up?
We gave cities and towns and school districts more than the Student Opportunity Act required between our Chapter 70 money, our UGA money, and our federal money. And we think, given the circumstances that we're all dealing with going into this fiscal year, that's quite an achievement. And obviously, we'll continue to work with our colleagues in the legislature and others going forward to make sure that we continue to live up to our commitments there.
But do you feel that the state is prepared to continue with those increases in the subsequent years?
I'm not going to speak to fiscal 22 today. I mean, there's a lot of work to be done associated with that one, and obviously we'll probably be standing here and talking to you about that when we file our budget in January.
Governor, you said that you don't believe that new revenues are needed, no new tax increases are needed in this budget. On paper, it looks like you've avoided some really drastic cuts, but some agencies like the MBTA in particular facing a $600 million shortfall potential, drastic service reductions. Did you think about, or do you believe any revenue is needed there to ensure that these services continue? Because as you know, once you get rid of something, it's harder to bring it back than to just change its owner.
I actually think with respect to the T, they do have the ability to move up and down and to move transportation assets, particularly bus assets, more so than some others, around based on how people are using the service. I mean, as we all know, there are plenty of commuter rail rides right now where you'd be the only person on a train if you got on it. That's a really big deal and a fundamental issue in how people think about what the nature of service should be there going forward. There are certain routes we've seen really significant ridership return on the bus system, and other routes where we basically don't have much of anybody riding on it. I mean, one of the things that T's talking about, which I think is reasonable, is whether they should move some of their assets from the places where no one's riding it to some of the places where people are, until such a point in time where more people do ride it. Those are perfectly appropriate conversations, given the current state of play, for them to have. I said before, and I'll say it again, I've ridden the T since the pandemic. I believe it is safe, and there are studies that have been done of multiple public transit systems in the US and around the world that basically say riding the public transportation system is safe. And I just want people to think about this one for a minute. What do people do when they ride the public transportation system for the most part? This is what they do. Honestly, I can't think of a less risky activity. There's not a lot of talking. There's certainly not a lot of yelling. There's very little engagement. Most people have their heads down, buried in their phone or a book or a newspaper. And there's plenty of distance. I would really like to see people give the public transportation system a try. People have done a lot of work to make it safe.
Governor,
Sorry, I was just also hoping you'd clear up for me. You talked in the healthcare spending sector, you talked about spending on healthcare being down, people being generally healthier, COVID notwithstanding.
Not healthier, just not using the system as much.
And less transmission of normal respiratory diseases.
But that's mostly coming because people are distancing and wearing masks, and they're not doing a lot of the things they were doing before.
Mass health enrollment up over
Yeah.
150,000 people, spending there up over
Yep.
$500 million. So is spending down in the healthcare sphere, or from the state perspective?
Well, the Group Insurance Commission, for example, which has a much more defined population than Mass Health, obviously in a period like this, you're going to see an increase in Mass Health enrollment. But if you look at the Group Insurance Commission spending, they're way below budget. And if you talk to the carriers, okay, on the private, on the commercial side, they'll all tell you, I mean, look at their quarterly financials. They're way better than they've been the last couple of years. And that's even with the perspective that they lost a bunch of members as a result of people moving from commercial coverage to Mass Health or to the Health Connector, depending upon what their particular circumstances were. But yeah, there's been a significant increase in Mass Health enrollment, which shouldn't be a surprise to anybody. But the run rate on healthcare spending generally, here and elsewhere, has come down by several points, primarily because of the big drop in utilization.
So you're seeing the savings at a budgetary level from state employees?
Yeah.
Families.
Yeah.
Crafted this budget without any reliance on, a future possible stimulus package from the feds.
Correct.
How important, you said that, it is important that they do pass another stimulus package, but how important for the future budgets in FY22 and beyond will those stimulus packages be?
Well, I mean, I've said before that, at least on the places where Washington can agree, House, Senate, Democrats, Republicans, administration, I think it would be helpful for them to act, because that would provide a certain amount of certainty. I mean, there's very little certainty right now because of the nature of the fact that they're close and then they're not, and they're close and then they're not. I mean, it's hard for people to plan. But that said, if you look, for example, at education, the House and the Senate and the administration were within, a few percentage points of each other on what they thought the right package for K through 12 education, childcare, and higher education would look like. And honestly, that would have been a terrific way for them to provide a lot of certainty to states and municipalities, and frankly to families and others, with respect to where there was a big opportunity to do something where they all agreed. One of the other areas they agreed on, in most of the earlier packages, was around what to do with respect to unemployment. That's another one that would have been a terrific one if there was in fact a fair amount of agreement where they could have provided a certain amount of certainty. There was also money in there around testing, which continues to be a critical element of how every state in the country is going to both identify cases and isolate and quarantine and manage spread over the course of the winter, the fall and the winter. That's another place where there was a fair amount of agreement. So I guess what I would say is my frustration is partly about uncertainty, but it's also about the fact that there are a number of areas where it was pretty clear Democrats, Republicans, the White House, the House, and the Senate were all more or less in the same place on certain things. And there are things that I think everybody would agree would have been important areas for them to come to terms on and to get something done.
Governor,
If the legislature wants to use more rainy day funding, if they want several $100 million more to increase spending, or we've paid up, is that the direction we're going to go in?
I would hope at the end of the day the goal here should be to use as little rainy day fund as we need to use to make sure that we provide the services and the supports to people here in the Commonwealth that they need to help get their way through this pandemic. And I totally believe, based on the conversations we've had with the House and with the Senate, that at least conceptually we're all in the same place on that, because we recognize and appreciate that 22, especially if nothing happens, is going to be a much more complicated year than 21.
Governor, is there sports betting in the budget? Can you speak to any of that, or what role, if sports betting were to pass,
We just put in what we put in when we filed the budget originally.
Okay.
But that, I think, that was in the House Economic Development Bill, right? Not in the Senate.
The House.
Yeah.
With your Stop the Spread campaign, you have testing sites, retesting sites. We're hearing that some of them are at capacity. Some people show up maybe more than 2 hours before they close, and they're going to turn away, not able to get a test. Do you have any plans to expand testing for?
So what I would love to do is have you talk to one of our press folks about, I've discovered that there are some things that are misunderstandings with respect to how some of these centers work on a number of anecdotal instances. But what I can tell you is that those sites are serving thousands and thousands of people, tens of thousands in some cases, every day around the Commonwealth. And they've been a tremendous asset to the communities in which they're operating and to the people who live there and to the people who are in the surrounding communities. But several times people have come here and alleged certain things that turned out not to be true, or at least they weren't accurate. And I think it would be helpful for you to, if you have a particular one, you should take it to Terry and we'll follow up on it.
Governor, beyond the budget, there's enough priorities that the legislature still has before them, that like housing they need to focus on. And it's been, since they extended their session, it's been 2.5 months and they've had no formal sessions. Then these bills have moved down the conference committee. Have you gotten a sense of why there's been such a delay from them as we move, toward election day past it at the end of the year? There really hasn't been any movement on some of those major priorities.
I mean, my answer to that would be most of the time, conference committees are complicated because there are many different elements that are really important to each branch. And in this particular case, if you think about the conference committees that are currently operating, they all passed bills that were conceptually consistent with each other, but had a heck of a lot of details in each of them that were different. And that stuff does take time. And I mean, I would love to see many of those enacted soon, but obviously, I get and respect the fact that those can be difficult negotiations.
Early voting starts on Saturday. So
other states around have huge people waiting in line for 12 hours. Any concerns about people waiting in line here and having difficulty voting?
I haven't talked to the Secretary of State about this for a while, but we talk to our municipal partners quite a bit. The Lieutenant Governor talks to them all the time. And I think people feel pretty positive about the way they are teed up and organized for early voting. And I have to say that in my own experience, we've had early voting now for, I think this is the third election cycle we've had it. It's worked really well. And I think the fact that we also have mail-in voting this time, and people for the most part have started to get their ballots in the mail if they ask for one, I think that will take some pressure off early voting. And I don't expect this is going to be an issue, at least based on what we're hearing from the municipalities.
How are you voting? Are you voting by mail? Are you early voting?
I haven't decided yet.
Who are you supporting for president?
You know, I think I may take a pass on that one as well.
Not vote at all?
We'll see. We'll see.
Secretary,
Governor, since you said
quick
we're talking
clarify.
about the T, did you say you've been writing it during the pandemic?
Post-pandemic. Yeah, during the pandemic, yeah.
So you're continuing
Recently,
to write.
yeah.
Secretary,
Once a
quick
week?
clarify.
Blue Line.
Blue line? Regularly?
It's a perfectly nice ride.
So we
Secretary,
spent a lot of time today talking about federal funding.
Is
Thoughts
that
on the
fully
Trump administration ending the
reimbursed or
census
to
count?
provide matching funds for healthcare?
I think getting the census count right is critically important. I don't know enough about what's going on in other states, but I think this is one where a few extra weeks of collection, especially given the impact the pandemic had on people's ability to do door-to-door work, would always be better.